Hi, I'm Sharon Sauer.
And I'm Mary Biancalana.
We are the co-directors of therapy and two of the myofascial trigger point therapists at the Myo Pain Relief Center in Chicago.
We've just completed our book called Trigger Point Therapy for Low Back Pain, a self-care workbook.
Low back pain is one of the most common and serious pain problems. This book is for anyone who suffers with pain in the low back, buttocks, and including sciatica, tendinitis, and bursitis. A primary cause of low back pain is trigger points, irritable tight spots and taut bands of muscles that are painful when pressed and which refer or trigger pain to both nearby and distant areas of the body. There are 11 muscles and muscle groups which refer pain to the low back.
Our book explains referred pain. Let me give you an example. For instance, if it hurts here across your low back, it may be caused by a muscle that is actually in your abdomen. Another interesting example of referred pain can be found in the Soleus muscle. This muscle is located in the back of the lower leg. Trigger points in this muscle can refer pain all the way up to the low back.
The book includes simple self-treatment protocols for each of 11 muscles and muscle groups that cause low back pain. It's comprised of 4 steps: warm-up, compression, stretching, and movement. By following the self-care program outlined in the book, you will be able to retrain your muscles to be pain-free and fully functional.
Myofascial trigger point therapists, like Sharon and I, practice a non-drug, non-surgical approach to pain relief. With over 50 years of combined experience in the field, the therapists at the Myo Pain Relief Center know that self-care is an essential component of pain relief.
In the 1980s and 90s, I trained with one of the pioneers of myofascial trigger point therapy, Dr. Janet Travell, President John F. Kennedy's personal physician during his years in the White House. Among her many accomplishments, she and Dr. David Simons wrote a 2-volume set entitled Myofascial Pain and Dysfunction, the Trigger Point Manual. These invaluable books laid out the foundations of trigger point therapy, but until now, there has not been a definitive book intended to reach out to the people experiencing the low back pain. We hope our book assists you in evaluating, treating, and eliminating your acute or long-standing low back pain and getting you back to full function.
Over the years, Sharon and I have trained thousands of patients on how to eliminate their own pain, and also through our monthly Myo Trigger Point seminars, we've probably trained hundreds of healthcare providers in myofascial trigger point therapy. We hope our new book will help you learn about this non-invasive alternative to drugs and surgery and teach you how to fix your pain and your own dysfunction in your low back and buttock. No one should suffer with low back or buttocks pain. Learn how to be pain-free
and learn how to stay pain-free.